Hello, everyone, and welcome to Age Better, where each week we take a deep dive into all the ways we can feel better, look better, live better, and age better. I'm your host, Barbara Hannah Grufferman. Today, we delve into a critical issue that affects millions and millions of women, yet remains terrifyingly underfunded: midlife women's health research. For too long, this lack of attention and resources has had profound implications for women's health and well-being as they transition into midlife and beyond. Menopause and the postmenopausal years are a natural part of every woman's life, yet the support and understanding of these stages have been significantly neglected for way, way too long. This oversight in healthcare research and resources has left too many women underprepared and undersupported during one of the most transformative periods of their lives. That's the bad news. But here's the good news, because there's always good news, right? Our guest today, Claire Gill, recognized these glaring gaps and took bold steps to address them. In 2019, she founded the National Menopause Foundation and then the Women's Midlife Health Policy Institute, which brings together thought leaders from various fields of women's health. The goal? To unite in one voice to advocate for necessary legislation, secure more funding for research, support programs, and create equity in healthcare for all women. This episode isn't just about discussing these challenges. It's about finding solutions and taking action. Claire Gill's work is a testament to what can be achieved when we tackle these issues head on with determination and, just as importantly, a collective voice. To our listeners, this is more than an opportunity to be informed. It's a call to action. It's a call to get loud, really, really loud. In this conversation, we'll explore ways that you can get involved and help push this crucial initiative forward in your communities, cities, and your states. Listen, everyone, your voice matters. Don't think it doesn't. And together, we can make a significant impact on the health and well-being of women at every stage of life. So, pop in your earbuds and find out how you can advocate for a healthier, more equitable future for all women. Stay tuned. Hello, everyone. I'm Barbara Hannah Grufferman. Welcome back to Age Better. My guest today is Claire Gill, who is the CEO of the Bone Health and Osteoporosis Foundation. I've been on the board for going on 10 years, so Claire and I have been working together for a very, very long time. But she's also the founder of the National Menopause Foundation. So today we're going to take a deep dive into recent advancements in women's health research and also take a look at some of the newest resources that are available to all of you who might be traveling through the menopause journey. So welcome to Age Better, Claire.
Well, thanks so much for having me, Barbara. I was thinking the other day about how long we've been working together. So it's a real treat to come talk to you about menopause instead of osteoporosis.
Right. I mean, I'm always game to talk about bones, always. So if you want to kind of veer off, talk about bones, good, let's do it. But let's start with this. Claire, what is the National Menopause Foundation and why did you start it?
The well and the why. So the National Menopause Foundation, I founded in 2019. And really it was because I became aware that there was no patient advocacy organization strictly for women at menopause, at midlife. And I thought that really couldn't be possible. But there were some hybrid organizations that had been around for a long time that had a nonprofit arm to them. But as a strict nonprofit, there really wasn't. And so we founded the organization to be a really relatable resource for women, for education, for resources, and for advocacy, as well as community building. Because we know that we learn so much from the women in our lives. And so people wanted to have a community where they could share peer-to-peer support as well. So that's why we created it. And We've been doing a lot of wonderful activities since then, and I'm really pleased that we are now not the only nonprofit in the space of women's midlife health and menopause. So there's a lot of great resources that we can talk about today.
Absolutely. And really is wonderful that there are so many more voices in the menopause universe.
Right.
There are a lot of celebrities who have entered with very loud voices. Many of them have come out with companies that have products to help with some of the more common symptoms. So there's a lot more activity, and that's just good for all women.
It really is.
To kind of raise that conversation. So the National Menopause Foundation Menopause Symptom Checklist, it's a crucial resource. Tell us about that.
Yeah. So what we don't know as we approach and journey to menopause is how early it can start and what are the symptoms that can be associated with it. So I think everyone seems to be familiar around the fact that, you get hot flashes, maybe night sweats when you're going through menopause. But there's a lot of different lists that talk about it. But the ones we focus on are the 34 symptoms that happen to women at menopause. And we also heard from women that they're often dismissed when they go to their clinician and ask about, this is what I'm experiencing, this is what I'm feeling. Either they hear, you're too young for this, because maybe they're not in the average age range where many doctors think women begin the journey of menopause, or they get told, it's just menopause. It's just menopause. So we wanted to have a checklist, one that, again, helped to educate women, be able to track, what am I feeling? What's happening to me? What's the severity of these symptoms? Are they a little bit or a lot? And then being able to use the checklist as a conversation tool and take it to your healthcare provider and say, hi, these are the things I've been experiencing over the last whatever period it is that you've been tracking, and these are what I want to talk about. And that's a really great way to either initiate the conversation if you haven't yet had the conversation with your healthcare provider, or to get them to pay attention to the fact that, no, there's really something going on. These are the things that you're experiencing, and you want to talk about it. So I agree with you. I think it's a fabulous tool for people.
It really is a fabulous tool. And there will be a link to that and really to everything that we're talking about today in the show notes section. So everyone, I hope that you'll take a look at those after you listen to this conversation. So you have a great resource, as we just said, the checklist at the National Menopause Foundation website. But what are some other recommended resources that you really think are great and that people should look at?
There's quite a few available. It's the fact that, again, people don't know where to find them. And so I like having information in one place and helping the National Menopause Foundation become a clearinghouse where people can get that information. But there is also a fantastic clinical education organization that provides information for patients as well as clinicians. And that's called, they just rebranded, that's called the Menopause Society. It was the North American Menopause Society. Now it's the Menopause Society. And their URL is really easy. It's just menopause.org.
Yes, I've referenced it so many times. I think that everybody listening is like, we already know what it is. It's menopause.org.
Menopause.org. But again, check out, again, it's written from a clinical perspective to tell women, and I think we were looking for things that, again, address more on a friendlier basis what women need to know or what they need to ask. But that is really one of the scientific-based great organizations that you can go to for more information. And then there's also information available, again, at all the government sites that allow you to pick up on what their research has done and then the tools that they have. And one of the first things we did was we met with all of the women's health offices at all the federal agencies to talk to them about, what are you doing about menopause? And I was shocked how many fantastic resources they have available. And so you really can just Google menopause government and you will get things from the HHS, which is Health and Human Services, the Department of Health and Human Services. They have an Office of Women's Health Research. And again, they have a whole section that's on menopause. And they have great tools that people can use as well. And I like to kind of make sure that people, again, are going to where there's scientifically based information and not things that have product specific stuff tied to it, because we want to make sure that, again, you get what you need and then you decide with your healthcare provider about how you go about treating your symptoms. I think that's really important too.
Yeah, it is. Just one thing I wanted to, before we go too far away from what was NAMS, menopause.org, is there a wonderful resource for finding a clinician, a healthcare provider who focuses on menopause in your area? And I often throw that out there to people who I really want to talk about my symptoms, but my doctor really isn't equipped to do so. He or she just kind of says, oh yeah, just deal with it. And I need to find someone who can understand my symptoms. So I encourage everyone, if you're going through this and you want to find someone in your area, go to menopause.org. And they do have a section on find a healthcare provider in your area. Yep.
That's an absolutely fabulous tool. And I do the exact same. The only caveat I will give for women is that there are not enough of those trained professionals around the country to be able to treat the number of women who are actually experiencing menopausal symptoms. So we are working to, again, how do we train more clinicians about it? But for those, if there is not someone in your local area who is a Menopause Society certified practitioner, there are now more telehealth organizations with certified practitioners who are available. And that wasn't possible years ago, but it is now.
Right. Can you name a few of those, Claire?
Yeah. So there's MediHealth, MEDI Health is one that has that. Genev, it's GENEV, was one of the first ones that came to market. And they've since been purchased by a larger company. And again, when you look at these, I sort of look at them as kind of concierge services, right? It's outside of your health practice and you're looking at it. It is to just make sure that the health credentials of the people who are running them are based on the NAMS or the Menopause Society practitioners. Because now there's a lot of people popping up saying, we're here to help you and telehealth you on all of your menopausal symptoms. Make sure it's still a credentialed healthcare professional who's providing those services.
Another one I'd like to add to that list is Electra. And, I believe that all of the healthcare providers have been properly vetted by these organizations. So that's a good recommendation. And I will have links to those as well in the show notes.
Yeah, and I'll provide you with links to some others too. There are more of them out there. And I think it is really important to make sure that we are identifying all the ones that we know of that are really credentialed and available to women.
Yeah, it's so important because the other thing too is that menopause, as we know, Claire, right? Because you're really in this space, is so personal. It's so personal. So what works for me might not work for you, and so on and so forth. And so you really do need to speak to a healthcare provider who can help you address your own personal experience. I mean, it's just like we all have kind of the same group of symptoms, but different degrees. And then some people have other symptoms that, other women may not have. So that's really, really important. I always stress how important it is. I think for whatever you're going through in your life physically, to really search for a healthcare provider who can work you in partnership, can help you through that particular physical and mental and emotional and spiritual journey.
It's so important. It really is very personal. And I hear that a little bit sometimes talking to people where women will say well, I just breezed through menopause. So I don't know why we need these organizations or all of this fuss has been said to me. And I try to point out that just like you said, it is so personal for every woman. And it's fantastic that you didn't have any debilitating symptoms. But I can't tell you the number of women I've spoken with who said it was worse than childbirth. It was the worst thing I've been through. I literally thought I was losing my mind. It's so debilitating. And so I think we need to make sure that we give not only ourselves grace, but also the other women in our community and in our lives that, wow, they may be experiencing something during this transition that you didn't.
Absolutely. And I knew I'd find a great way to kind of segue back to bone health, Claire. I knew I'd find a way. And here it is. Not only do women at different degrees, as you just pointed out, experience some of these like hot flashes, sleepless nights, and mood swings and the like, very, very common symptoms as you're really perimenopausal before you actually become postmenopausal. But what's also happening are things that you don't see that are happening. Like your bones could be getting, I don't want to say are or will, but could be getting weaker and thinner because of the fluctuation in estrogen and then the eventual drop in estrogen. Your heart is being affected. We know now that your brain can be affected. And we know now that your heart could be affected because of your hot flashes could be so severe. So there's so much going on, everyone, that it's not just those kind of common symptoms. It goes so much deeper and so much longer, which is why I say you really need to be as knowledgeable as possible. And that's why these resources and all the good work that Claire and her peers in that space of menopause are doing. So let's get to the Women's Midlife Health Policy Institute. Tell us what that is and what is its mission.
So one of the things that I realized too, after working in the women's health space for a number of years, and obviously on Bone and others, and doing the work that we're doing on menopause research, which we'll talk a little bit about, Menopause Research and Equity Act, as well as some of the other legislation that's now coming to the fold, is that across women's health, we need to come together, just as you said now about the heart conditions that can happen, obesity, diabetes, breast cancer risk goes up after menopause. There's lupus, fibroids, migraine, all of these things that are impacted by the fact that we've reached midlife and by the lack of estrogen in our bodies. So as we think about advocating for what we need to improve in women's health, we wanted a place where all of those different conditions, like all the advocacy organizations that work on all those different conditions, support women's midlife health, can come together in a facilitated way and talk about how do we do things together.
Yeah.
We're all campaigning on our own and doing this. How do we the holistic look at women's midlife health? Because we're stronger together. So we can look at those issues that I already know off the top of my head. I can sort of say a couple of these things like access to treatment is really important and an issue across every condition we've just named.
Yes.
Healthcare providers who are knowledgeable and able to address what is happening, like cardiovascularly, but specific to women, with weight gain, but specific to women. All of those things are really important. So the Women's Health Midlife Health Policy Institute is a place where we are gathering all of those stakeholders, clinicians, patient advocacy organizations, policy leaders, and talking about how do we advance all of women's midlife health at, again, every stage of menopause, et cetera. Yes, together.
And doing more research as well, correct?
And then do more research around it, yes. And then elevate and amplify all the great work that's being done in each of those areas that improve women's health. But we need to know about it first, and we need to come together and talk about it. And I keep hammering home from people that we have to be strategic about how we approach particularly policy changes, because otherwise we're going to spend a lot of time talking and there's going to be no action.
And no action.
And there needs to be action. And so that's what we're doing.
How can the Institute be used to impact policy? Like, how is that actually going to happen?
So the first thing we're doing,
expect?
Yeah. So the first thing we're doing is we're hosting a Midlife Women's Health Summit on March 21st here in Washington, D.C. And that is our first opportunity to bring together some of those stakeholder leaders to say, where do we see the priorities and how do we develop an action plan? And so I want to make sure that we're able to get all the information in to help prioritize. And then from that, we're going to create an action plan that we will make available to every organization, every group, every stakeholder who's interested in it, and think through what are those immediate next steps, and then what are the longer term things that we can work towards together. So that's the first step in the activities that we're doing. But we'll also be doing briefings on Capitol Hill around, again, what are the commonalities around women's midlife health and how can Congress help address the needs there. We'll be doing communications campaigns about women's midlife health and what women need to know and where, again, they can get resources for all of these issues. And then, as you said, also looking at research. Again, how do we address things that need to be done for women's health? And that's not just specific to even menopause or not specific.
I was just going to ask you, could you just clarify that? So if someone is listening in and saying, okay, well, I'm past the menopause years, this is also going to benefit post-menopausal women.
It is. We say midlife women's health, and it's up to you what your midlife is and what my midlife is.
Right.
Really depends on how long we live, so.
Sorry to interrupt you, but I'm recording another episode actually this week with Chip Conley, he's a New York Times bestselling writer and an entrepreneur, and he founded the Modern Elder Academy out in California. And anyway, he's really just brilliant. And he has a new book out now that's already a bestseller. And anyway, he talks about midlife. He defines it as, are you ready? Between 35 and 75.
That is, but isn't that
I'll
true?
Leave that with you.
Maybe 75 is a little long, but there was a woman in Maryland just celebrating her 109th birthday. So shout out to that lovely lady. It's true. I mean, we never know how long we've got. So we could be in our midlife at 30, like you said, if you end up anyway.
Yeah. Well, anyway, I just thought that was really pretty fascinating. But yes, continue.
So that's it. Again, thinking about midlife, whatever that is. And really looking at women's health, but particularly, I would say, sort of at the onset of those menopausal symptoms, right? So I think perimenopause, again, that could be in your 30s. Many women in their 20s and 30s start experiencing symptoms. So whatever that is. But again, we can't just say, oh, let's focus on menopause specific. That's hugely important. And it is the center of midlife. But also, again, like I said, there's so many other people we could be collaborating with around the things that impact us at menopause. And so that's really the point of the Institute. Yeah. And I hope we'll be doing great work together. And I'm incredibly relieved and excited to see the response and enthusiasm from people when we launched the Institute and said, hey, let's really bring everybody together and start thinking about this strategically across all of women's health, midlife health. And everyone's like, yes. So I look forward to doing more of that.
So this really was an initiative put forth by the National Menopause Foundation.
It's housed under us. So it's really just a program of what we're...
Perfect.
Our policy efforts are going to be this institute. And then we'll be collaborating with others. And we talk a little bit more about some of the really great things that are happening policy-wise in menopause right now.
Mm-hmm. Yeah, let's talk about some specific legislation that's currently being considered in Congress, such as the Menopause Research and Equity Act of 2023. What are the key components of this, and how do you think it can transform menopause research and women's health research in general? Tell us about that.
Actually, one of our champions on the Hill in the bone health space in 2022 put forward the Menopause Research Act. And unfortunately, he was retiring from Congress at the time, and it didn't get passed during his tenure. So fortunately, we had some great members of Congress who picked up on that, and really excited that they did because it is so incredibly important. So Yvette Clarke from New York and Congresswoman Lesko from Arizona were working with us. And when I say us, it's one of the other fabulous nonprofits in the menopause space, what they're called Let's Talk Menopause. And they worked with Representative Yvette Clarke's office to revitalize that legislation. And together, we made sure that we had everyone excited about it and had a press conference in Washington, D.C., where we announced the new legislation. And the purpose of that legislation is basically to have the National Institute of Health direct money specifically to research around women and menopause. And there's some really incredible facts about, if you didn't know, that it was only 30 years ago, that it was mandated in federal research that women be included in clinical research. It is amazing. So not surprisingly,
it is amazing.
A lot of research has been done, and there's good research being done around, again, women's health across the entire lifespan. Super important. But there has been a huge gap, right? We care about women until they're done with their reproductive years, then not so much. So this research is really focused on menopause and what we don't know about menopause and how to bring about. And the equity aspect of that was added specifically for the 2023 legislation. So we really, I think, improved upon it, because when we talk about some of the things that are happening, great advances, and I know you and I have touched on it before about, again, the studies that the National Menopause Foundation did with Bank of America about women in the workforce.
Which we'll get to.
But then we're only talking about a certain group of women, those of us who go to offices, right? We're not talking about women who are working in hourly jobs or those who are in positions in hospitality. And so it really was important that we look at equity across this research. And what's fascinating about the female body, and particularly about menopause, are the symptoms that we experience are actually dependent sometimes on our race and ethnicity.
Yeah, absolutely. And how you experience these symptoms.
So when we talk about research, again, we want to make sure that we're not just doing research on menopause in one particular group. We want it to be across all women that experience the menopausal symptoms. And that's a really important act. It is now introduced in Congress. And what we're doing, the process, if you remember back in the day, where we had I'm Just a Bill on Capitol Hill, the little schoolhouse rock. So what happens is now we have to get other members of Congress to co-sign onto that legislation. And so you can write to your member of Congress, call your member of Congress and say, we want this to be a focus of something that you vote yes for. And so that's going to be really, really important. And I encourage all people listening to take advantage of that and to really reach out and contact their member of Congress about it. That is an easy thing to do too. You can just Google your member of Congress. If you don't know, it gives you a direct phone number. It gives you their address, anything. You can easily do that. Or you can also go to the Let's Talk Menopause website, and right on one of their homepages, they have a tool that you can just enter in your information and it will send the letter on your behalf. So easy ways to get involved.
And all of that will be in the show notes. And I really encourage all of you listening or watching, if you feel this is important, and I know that you believe it is, please take action. Please go to also nationalmenopausefoundation.org. Did I get that right, Claire? nationalmenopausefoundation.org. And you can get to Let's Talk Menopause from there. And you can also then see all the great resources that National Menopause Foundation offers, or go directly to Let's Talk Menopause. A great, great partner for National Menopause Foundation for sure. They're doing really good work, Claire.
It is. Like I said, I'm just so excited that there's so many more organizations that are involved in this. And I think it's also really important, again, that we're all working together to advance this.
Yeah.
So, great stuff.
And you didn't mention that there was a photo taken of you when you were up on Capitol Hill, kind of helping to push this through with Halle Berry.
That's right. Well, you mentioned, you mentioned that there was, again, there's a lot of more celebrities and real influencers who were doing it. So yes, Halle Berry was on Capitol Hill. And I joked with everybody. I was joking with the congressman that I was meeting with afterwards. And I said, I've been talking to you about menopause for 4 years. Nothing happened. All of a sudden, Halle Berry shows up. What has she got that I don't have? And everyone does that awkward laugh, like, do you really want us to list it for you? She was delightful. She is a true champion in this space. And there are many others as well. But really, again, to be out there on Capitol Hill and saying, hey, this is something that I'm willing to talk about and I'm willing to raise awareness about it, but we have to do something about it. And so she was there for the launch of the Menopause Research and Equity Act and has been going door to door, really, on Capitol Hill, saying, what do we need to do to prioritize this? So really grateful to her. And all the
that's really great. I mean, look, celebrities really do help. There's no question about it. Where are we right now with this, Claire? I mean, are we almost there? Do you know what the status is?
Yeah, it's really just beginning. So it's a great opportunity. And we said what we need to show and we need to demonstrate is that there is great interest in this and great need. So that's why we need constituents, you and me, calling and writing to members of Congress to say, this needs to be a priority. This needs to be a priority. Because spending a lot of time on Capitol Hill educating our policymakers about, obviously, osteoporosis and bone, and now menopause, I know that they prioritize what they hear from their constituents. So you really do need to get involved and act up. Be loud about it.
Get loud, get active, and get loud.
And we have
loud.
power. We have power to do that.
We absolutely do. And so let's use it, everyone. And this has nothing to do with your political affiliation or orientation at all, everyone. Not at all. It has to do with the fact that you are a woman, or you might be someone who loves a woman and cares about women, and just let's help to push this through. So we're counting on you. Okay, let's get back to Bank of America. You mentioned them before. Bank of America, in partnership with the National Menopause Foundation, last year sponsored, I want to read it exactly, Breaking the Stigma, Menopause in the Workplace, a study. It was amazing. Really, really dug deep. And tell us a little bit about that and how was it used?
Yeah, so it was fantastic to partner with Bank of America, and they have incredible access and resources to address a lot of different areas of concern for their customers. And they've done great things on caregiving, by the way, if you want to check that out. They've done things on Alzheimer's, and their leading executive was interested in pursuing menopause. And we were introduced and worked with their team to create this survey that they then did with both human resource professionals and employees about why is there the stigma in business around menopause? What do women need to be able to stay in the workforce? And the great concern is, believe it or not, quite a number of women leave the workforce now, again, at midlife, when we're at our most senior positions, when we're at our most powerful, as we said, when we're so competent. But because the symptoms are so debilitating, they actually step away from the workforce. And some of the statistics have said even 30% of women worldwide do that. And so they wanted to address that. How do we keep women satisfied and working and productive in the office? And so, and supported. So that's what we looked at. And the Breaking the Stigma report that came out of that was the tool that we use to have these conversations and start the conversations about what offices and what companies need to address. So key findings were really interesting in that the number of women who say they feel supported or that their company addresses what they need at menopause was very low. And the number of HR managers who were asked sort of, what's your corporate culture and how do you address it and are there things in place, was pretty good. So there's a definite disconnect.
Wow, little gap there. Disconnect for sure.
So those were some of the things that we were talking about and why do those happen and what can be done about it. And honestly, education and the conversation about menopause in the office was one thing that everyone agreed was a great first step. If we can talk about it, if it is known that we can talk about it and we're not going to face the stigma of ageism or, again, some stigma about menopause symptoms in general, then there was more willingness to act on it. And many of the things that we have all fought so hard to bring about in policies in the workplace, for example, family leave, or even for the reproductive years, breastfeeding, lactation rooms that are, acceptable, or being able to work from home with flexible hours. So many of these things are in place that would help women who are suffering through, like I said, often sometimes debilitating menopausal symptoms, but they're not labeled as such. And so what we really need to do, again, is say menopausal symptoms are something that women experience, and here are the things within our company policies that you can take advantage of to address it. So there might not be anything they need to even add, but they just need to make sure, again, as leaders within the company, that they are including menopausal symptoms as something that can be a reason to take advantage of policies that are already in place. And then we're also looking, obviously, at what are some of the newer policies or things that we could do that are specific to menopause, perhaps, that might be beneficial. But right now, again, it was really eye-opening to see that disconnect between how we women feel in the office and what the company culture thinks about what they offer. And, it's all right there. Just take advantage. Because of menopausal symptoms happening at midlife, and unfortunately, the fact that there is still a stigma around it, and certainly on ageism, as we're talking about aging better.
Yeah, it's a double whammy.
It needs to be top down in this instance. It needs to come from the leadership at the company saying, we are going to bring up the subject, versus the woman executive who might, in many instances, be the only women executive at the table saying, hey, can we address menopausal symptoms? It's got to be company-wide.
Do you feel, Claire, that the UK is doing a better job in this area than the US is? I mean, I do see, because this is of such great interest to me and has been for a number of years, I do follow research and the various organizations that have popped up in recent years in the UK and the articles that I'm seeing. And I just feel there's much more chatter around menopause more openly in the general media. In fact, I recall this was about 2 years ago, might have even been during the middle of the pandemic, where an actual course about menopause was introduced into the curriculum in the schools so that kids would start to understand what their mothers or grandmothers or aunts, et cetera, were going through. And I just feel like there's more conversation around menopause.
Well, they've got about it.
And women's health in the UK than here, and we're catching up. Would you agree?
Absolutely. They got about a 10-year jump on us, really.
Yeah.
It's not to say that we can't catch up quickly, but we also need to think through sort of, again, the strategy by how that came about and what happened and why did they start addressing this. And interestingly, it really was motivated by workforce issues. But in the UK, they had an issue where they didn't have a large enough pool of younger women to take over and move up in ranks when they saw a dramatic loss of women that just coincided around with midlife years to leaving the workforce. And when they investigated why, it turned out it was because of menopausal symptoms. So there was an economic incentive for them to address it. It became something that their businesses looked at and went back to their government and said, do something about this. And so that's why it, again, started enacting legislation, looking at ways that they could take advantage of providing a response to this sort of midlife women's health crisis they were having. The other thing, too, is remember, they also have a very different healthcare system. So in the UK, as in many countries that are far advanced from us when it comes to healthcare in general, but also women's health in particular, is when they have a national healthcare system, then you basically are convincing one group, the leadership of that healthcare, literally the minister of health, to address it for the country. And then it gets rolled out in every healthcare provider and hospital, et cetera, et cetera.
Right. So in that case, it's a lot easier.
Much easier. I mean, no, I don't want to diminish how hard they worked to bring that about. It still took a lot of work
to get it there.
But the implementation for them becomes so much easier when it becomes a mandate from the government, right?
Right.
We, as you know, do not have that unified healthcare system. And so the number of providers that we have, all who, as we know, accept a variety of different insurances, different insurance companies, private insurance companies, you can't mandate them to give coverage to something. And so we will have a lot more work to do to implement this, but it doesn't mean that it can't be done. It just means it's taking longer for us to do in the US. And when you think about healthcare in general, and particularly even the things that we need as a workforce. I mean, if you think about how long it took to get maternal and parental leave, when I mentioned, it was only 30 years ago that it was mandated that if you got federal dollars for research, you had to include women in the research. Well, as you know, it was only a generation or two that before there was no maternal leave. There was nothing in place to keep women working or to even think about them, what their needs were in the workforce. Here's the interesting part, though. What has changed so dramatically is how much women in the workforce are responsible for our GDP as a country. And so that has changed more dramatically than any of the resources or any of the benefits that have come about in the last few decades. We are now, like we said, worldwide, the majority of the population is female. And that, again, changed within the last couple of decades. So that, and again, the number of women in the workforce and the amount we contribute to the gross national product and stuff, that can no longer be ignored. So it's a wonderful time to step forward and say, we love it. We are contributing members. We're doing fantastic things. And here's what we need to be at our best.
Right. So everyone, once again, we're really asking you to get louder in what your demands are, in just more health research and funding and more focus on menopause and in all the ways that Claire has just been talking about. It really is our right.
It absolutely is.
Yeah, it really is. Claire, this was an incredible conversation, and I applaud you and your peers and your team and all the other organizations like Let's Talk Menopause that are really doing such good work. National Menopause Foundation, kind of hard to believe that it didn't exist before. It really is. Like, it's kind of mind-blowing when you think about it. But I am so, and I'm sure everyone listening in, we're all so very happy that you had the brilliant idea like, hey, let me start this back in 2019. So thank you for that. So we covered a lot. Again, there will be links to everything. I really want people to pay attention to this, such an important part of our lives and future generations of girls and women's lives. So please, everyone, let's really band together and take action. Check out the links in the show notes, please. And call or email or whatever, however way you want to get to the person to really help with the bill that's currently in Congress. So appreciated. Claire, what are your 3 biggest takeaways you want to make sure everyone remembers today from our conversation?
There's more than 3. But again, just like you said, I want women to be empowered by the amount of information that is available now that has not been available before. So it is okay to ask for help. It is okay to request modifications that we might need for menopause. So again, just be empowered now at this stage of life. 2, like you said, get involved. However you want to get involved in improving women's health, whether that, again, is through our work or in your local communities doing things, at the state level doing things, check out what's available and get involved, because we can no longer sit back and just assume that someone else is going to do it. We need to do it.
Right.
And I think that's it. And then the third one is to really give yourself grace during this stage of life. Remember that every woman will travel through menopause at some point in her lifetime. And so it's the commonality among us. We might not all be moms. We might not all do different things. But if we live long enough and if we're healthy enough, we will all go through menopause. So again, give yourself grace in knowing that half the population is experiencing what you're experiencing, or they will.
More than half.
Or they will.
More than half.
So again,
will.
give yourself grace as you're trying to navigate this. We weren't taught about it, as you said, and we're hoping to change that. But now there's information we can get. So really, empower yourself, get involved, and give yourself grace.
Thank you so much for that, Claire. And everyone, National Menopause Foundation.org. You'll get a lot more information there. Claire, thank you for joining me. I know you'll be back.
Thanks so much, Barbara.
Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.